Hey guys, happy Wednesday. As you know, we have been talking about careers and we're going to continue that journey. Last week we wrapped up physicians, and that included medical doctors and doctors of osteopathic medicine, as well as some other non medical school doctors, including chiropractors, vets, optometrists, just to name a few. So now we're going to kind of take a step down in regards of how much schooling you're required to have and talk about physician's assistants and advanced practice registered nurses. All right, so let's just take a second and think about this. When you go into a doctor's office, how many healthcare professionals do you actually interact with? Well, when you walk in the front door, usually there's a front office person that will help sign you in. Then most likely you have a nurse or a medical assistant take you back and, do your vital signs, get some information and work you up before the provider comes in to see you. But then many times you may see a doctor, or you may see a physician's assistant or a nurse practitioner. And if you didn't know that's who you were seeing, you probably wouldn't be aware. All right, so what is a PA? These are the credentials, just like we talked about the MD and the DO. Those are the credentials that those physicians sign after their name. A physician's assistant is going to sign PA after their name, and that's what it stands for, physician's assistant. So, physician's assistant, their name is very telling of their career. They have to work under a physician, okay? They are considered a provider, just like a doctor is, but they work under the supervision of the physician in that group. Now, that doesn't mean that the doctor has to be in the same room as them, but within that practice, there is a physician that they associate themselves with. So, let's talk about some of the other things they can do. If a doctor can do it, they can do it as well. They provide care of all body systems. So just like a doctor specializes, a lot of times we will see physician's assistants specialize into a certain body system as well. Now, the benefit to this career is there's not a residency for physician's assistants. Once they graduate, they are hired on with that physician or that group, and they receive on-the-job training. So you would start making your salary at that time without doing that 2 to 3 year residency and fellowship, however long that may be. And depending on what body system, and that usually determines kind of your patient population, so that would vary based on how specialized they are. All right, let's talk about school. I think that you might be pleasantly surprised, but like the physicians, a physician assistant has to have a bachelor's degree, which we know is 4 years of undergrad, so 4 years of college. But then PA school is only 2 years, okay? So it's half the time of medical school, so you're saving 2 years there. And then you're also saving that residency and fellowship time, okay? So when they graduate, they actually graduate with a master's degree. They don't have a doctorate degree like a physician would. They have to sit for a licensing exam after they graduate, just like a physician would. But the great thing is they have the flexibility to change between specialties. So let's just say I'm a physician assistant and I wanted to go work in gastroenterology. Well, I've done that for about 10 years and I'm kind of bored and I want something new. Well, I can just move on over to pediatrics and get on the job training there without having to do a residency, without having to do a fellowship like a physician would most likely have to do in that same situation. So, pros here, a lot less school, therefore a lot less money on school being spent, and then you can immediately go to work instead of the residency programs that physicians have. Now, We'll talk about salary here shortly whenever we get to that slide, but naturally they do make a little bit less than a physician would because less school and a little bit less responsibility. All right, moving on. So in that same category as physician's assistant, we have a few other advanced practice registered nurses. Okay, we've got a nurse practitioner, which is probably what you're most familiar with. Then we have a nurse midwife, a nurse anesthetist, and a clinical nurse specialist. So let's talk a little bit about them. All right, they're all advanced practice registered nurses, highly trained. Nurse practitioners, certified nurse midwives, and let me get this back to this slide. Nurse anesthetist have prescriptive authority. The clinical nurse specialist, I don't think has prescriptive authority, but I have to go back and look at that. They can order and interpret diagnostic tests, and in some states, they can open their own practice without a physician. I know that South Carolina is one of those states. When I was getting my master's, there was a nurse practitioner that had plans on opening her own practice in in South Carolina, because unlike Georgia, you didn't have to work under the supervision of a medical doctor. So, all of the things on this slide tells me that they are also considered a provider. So far we have an MD that's a provider, a DO, a PA, and now these advanced practice registered nurses. Okay, so let's talk a little bit more about that. This is what they can do. A nurse practitioner can serve in any area of medicine just like a PA. So they would specialize in whatever interests them and receive on-the-job training. They wouldn't have to do a residency or a fellowship. Now, a certified nurse midwife is different. This is a very specialized career choice. They monitor pregnant women and they deliver babies, okay? Now, if they have a C-section, it is the law and regulation that they have a medical doctor with them in the room. They cannot perform that C-section by themselves. However, they can deliver a baby vaginally by themselves. A CRNA, certified registered nurse anesthetist. They provide anesthesia for surgical patients and monitor during surgery. So if you want to go into anesthesiology, but you know you don't want to go to medical school and do residency and fellowship, this might be a great career choice for you. Most hospitals hire CRNAs. They'll have hire about one anesthesiologists and have that one person there per day, but mostly everybody that's with a patient in the OR room is most likely going to be a CRNA. And then that doctor just kind of circulates through the OR and checks in on his CRNAs. All right, CNS, clinical nurse specialist. If you like research, this is definitely the job for you. I worked with a clinical nurse specialist at Gwinnett Medical in the congestive heart failure unit, but basically they work to implement evidence-based practice. So they are working with patients, but they're also working with research. And what they're doing is they're finding new ways to do things, better ways to do things, research-based ways to do things. Even if it's not the way we've always done it, well, the patient has better outcomes if we do it this way, okay? So that's kind of their focus. All right, let's talk about the school. So in order to be an advanced practice registered nurse, you first have to become a registered nurse. That's that first step, okay? You have to have a bachelor's degree in nursing, okay? And most of them are going to want you to have some experience. So you're probably not going to be able to graduate nursing school and then hop right into your program, okay? You need to have some time working, gain your skills, and then apply to your advanced practice program. Generally, they're 2 to 3 years. My experience is more like 2 years. Some are full-time, some are part-time. That part-time may be more like 3 years. And you would graduate with a master's degree and then have to take your licensing exam just like with the other providers' jobs. Okay. And just like PAs, if you want to switch areas of specialty, you can do that and get on-the-job training. You don't have to go back for your residency or fellowship. You can just switch and When you get bored, change it up. All right, so here is a list of healthcare careers that are considered providers, okay? This will come up if you continue in the pathway. We're going to talk about it next year, and we're even going to talk about it in your third year. You have to know, okay? And what sets these people apart is they can evaluate you, they can order tests, they can prescribe medicines for you, and they can do treatment plans for you, okay? A registered nurse can't do that. A medical assistant can't do that. These are the people that can do that, okay? So you need to be familiar with these acronyms and know what they stand for. So they have more advanced training, both educationally and clinically. We want providers to have that, because you don't want to go to a doctor, they've only had to go for 4 years and they're going to cut you open. All right, we want them to go to medical school. We want them to get these master's degree. Nurse practitioner and physician's assistant are just a great opportunity if you know you don't want to go to school as long as a medical doctor. Here are the salary levels based on the different licensures. MDs and DOs, 10 plus years of education, including their residency and fellowship, you're looking about $227,000 annually. PAs and nurse practitioners, around 6 years of education, and usually they are pretty comparable in their salaries. They're going to be making about the same amount, okay? If you have any questions after reviewing this presentation, don't hesitate to send me an email, but we will talk more about this at our next class.